So today's topic is fascia of the leg. Last time we did skin, its cutaneous innervation, and dermatomes. Below the skin, there is fascia, which comprises of two layers, superficial layer and deep fascia. Deep fascia in the leg gets attached above with thighs deep fascia, which is called fascia lata. It fuses with the fascia lata above. Below, inferiorly, it gets attached over the anterior and medial borders of tibia, where it fuses with the periosteum. The modifications of deep fascia of the leg include two intermuscular septa and retinacula over the region of ankle joint. Intermuscular septa, which are two in number, they arise from the inferior surface of the deep fascia of the leg. They get attached on the fibula and with the help of interosseous membrane, divide the leg into at least three compartments. The compartment anterior to interosseous membrane and between tibia and anterior intermuscular septum is called anterior compartment. The compartment that lies between anterior and posterior intermuscular septa and fibula behind is labeled as lateral compartment. And the compartment behind the interosseous membrane is labeled as posterior compartment. Retinacula of the ankle is another type of modification of the deep fascia of the leg. These include a superior extensor retinaculum, inferior extensor retinaculum. Then we have a small flexor retinaculum. And then on the lateral side, we have two peroneal retinacula, superior and inferior. The superior extensor retinaculum gets attached to the distal ends of the anterior borders of tibia and fibula, whereas near its medial end, it splits to enclose the tendon of tibialis anterior. And it is this muscle that will pass under the superior extensor retinaculum within its synovial sheath. Function of the superior extensor retinaculum is to hold the tendons of tibialis anterior from medial to lateral, tibialis anterior, extensor hallucis longus, anterior tibial vessels, deep fibular or peroneal nerve, extensor digitorum longus, and fibularis or peroneus tertius. Second very important retinaculum in the region of the ankle is inferior extensor retinaculum. It is Y-shaped, having two limbs and a stem. The stem of this retinaculum gets attached to the calcaneum, whereas the upper limb gets attached to medial malleolus, where it splits into superficial and deep layers in order to enclose the tendons which are passing through or underneath it to form compartments for those tendons. The lower limb of the inferior extensor retinaculum is continuous with the plantar fascia at the medial border of the leg. Its function is to hold the tendons of fibularis tertius and extensor digitorum longus. Then we have another thickening of the deep fascia in the same region, which is called flexor retinaculum. It extends from the medial malleolus, running downward and backward to get attached over the medial surface of the calcaneum. It binds the tendons of deep muscles to the medial side of the ankle. Then on the lateral side, we have two retinacula, superior and inferior peroneal retinacula. The superior one extends from the lateral malleolus, runs backwards and downwards to get attached over the lateral surface of the calcaneum. Its function is to bind the tendons of peroneus longus and brevis to the lateral side of the ankle. The last retinaculum in the region of the ankle is inferior peroneal retinaculum. It gets attached over the calcaneum above and below the peroneal tendons. The peroneal tendons here are referring to the peroneus longus and brevis, which are the two muscles from the lateral compartment of the leg. Now, a few points regarding the interosseous membrane. Interosseous membrane, the name is indicating, is a type of membrane, or it is a fibrous sheet that extends between the two bones of the leg, the medial tibia and lateral fibula. And it gets attached over their respective interosseous borders. The direction of the fibers of the interosseous membrane is that these fibers, they run obliquely downward and laterally towards the fibula. A large opening is present within the upper part of the membrane. And why is it there? It is going to allow the passage of anterior tibial vessels to enter the anterior fascial compartment of the leg from behind. Here we can see an opening in the upper part of the interosseous membrane, and this opening is basically for the passage, to allow the passage of the anterior tibial vessels from behind the posterior compartment of leg to enter the anterior compartment of leg. A similarly small, very small opening is present or can be seen in the lower part of the interosseous membrane, and it is going to allow the passage of the perforating branch of the peroneal artery or fibular artery to enter the anterior fascial compartment. This membrane, interosseous membrane, inferiorly is continuous with the interosseous ligament of a joint. As you can see below in this diagram, the joint inferiorly is the inferior tibiofibular joint. So this membrane is going to get fused or become fused or continuous with the interosseous ligament of this joint. What does it do? Why do we need this interosseous membrane? What is its function? It basically binds the tibia and fibula together and provides attachment for the neighboring muscles, as well as we just studied with the deep fascia and intermuscular septa. With the help of anterior and posterior intermuscular septa, interosseous membrane is going to divide the leg into three compartments: anterior compartment, lateral compartment, and posterior compartment.